My name is Mike Taravella. I'm an Associate Professor of Ophthalmology at the University of Colorado and the Rocky Mountain Lions Eye Institute. I'm pleased to introduce a new tree find system from Surgical Specialties. This is a case of pseudophakic bullous keratopathy. The case begins by marking the center of the cornea. The geometric center of the cornea is found using calipers. The cornea is then marked with a marking pen to highlight the area. A 12-blade radial keratotomy marker is used to help define the suture placement. Calipers are then used to decide what size tree find to use. In this case, the calipers are set to approximately 8 millimeters. The donor cornea is then transferred to a punch. The donor is centered within the punch. A plastic ring guide is then placed directly over the punch. This allows a very vertical cut. The donor tree find is then placed into the circular guide. Then firm downward pressure is placed directly on the cornea. The blade is carefully removed. The donor tissue is then inspected very carefully to make sure that an adequate cut has been obtained. It appears to be a very clean cut. Inspection of the donor rim is done to ensure that the tree find was centered. The recipient tree find is very similar to other suction tree finds, except it has all metal construction, very smooth movement. The inner blade is aligned with the suction barrel. Using the pre-placed mark, the tree find is placed directly over the cornea. The crosshairs within the tree find aid centration. This tree find has a very nice thumb and forefinger grip to be held with the left hand. Suction is applied. Once suction is applied, it's no longer necessary to sight directly down the barrel. The all-metal construction is very nice for several reasons. It has a very nice ergonomic feel and look to it. Also, the tree find does not bind as this blade is advanced. 3/4 turns is equal to approximately 0.25 millimeters in depth. In this case, a total of about 8/4 turns is used. Next, the cut is inspected. As can be seen, the cut is quite uniform. Penetration has occurred near the 12 o'clock position, and this is where the eye will be entered. The opening is extended to allow scissors. Corneal transplant scissors, first to the right and then to the left, are used to remove the recipient button. Gently grasping the recipient button and applying traction allows good visibility of the cut with scissors as it is being made. A very nice vertical cut is obtained by the tree fine. The intraocular lens appears to be well centered and well sized and was therefore not removed. The donor cornea is then gently transferred onto the field. It is inspected to make sure there was a clean cut. A very nice vertical cut is attained. Pollock double-prong forceps are used to stabilize the cornea for the first bite. The Sharpoint half-circle 10-0 nylon needle is used for the cardinal sutures. The Sharpoint half-circle needle allows for very deep, short bites. Unlike other needles I've used in the past, the Sharpoint needle is resistant to deswaging, bending, or dulling of the tip. This is certainly advantageous in a training program. A 2-1-1 knot is used on this particular cardinal suture. This allows the knot to be buried very easily. The donor cornea is then gently approximated into the recipient bed. The second cardinal suture is placed near the 6 o'clock position. Colibri forceps are used for the next bites. Cardinal sutures will be placed at 12, 6, 2, 4, 8, and 10 o'clock. Next, a double running suture is placed. The first running runs counterclockwise around the graft host margin. It is tightened and tied so the knot is buried near the 12 o'clock position. The second running is placed in an anti-torque manner, again approximately 12 bites, in between the first running suture. This suture runs clockwise around the graft host margin. The knot is again tightened and tied so that it is buried near the 12 o'clock position. Again, it is very easy to obtain sharp, deep, short bites with this needle. Tension is carefully checked on the running suture before tying. A Terry slip knot is used. This knot buries quite easily. The anterior chamber is filled to a moderate pressure with balanced salt solution. The wound edges are carefully checked. There are no wound leaks.